the end of this course, each of you should be able to read and interpret in the basic ECGs, which we see in our daily practices. You should be able to diagnose common arrhythmias, bradyarrhythmias, as well as tachyarrhythmias. You should be able to diagnose STEMI cases and localize the infarct-related artery in STEMI patients. You should be able to diagnose changes related to other ischemic heart diseases, and you should be able to diagnose chamber enlargements, and you should be able to have a fair idea of non-cardiac conditions also, like electrolyte disturbances, acid-base disturbances, as well as pericardial diseases like acute pericarditis, chronic constrictive pericarditis, just from an ECG. And lastly, you should also be able to identify and interpret ECGs in patients who have undergone pacemaker, ICD, and CRT implantations also, as we've added that course to our module as well.
Yes.
Now, the last question is, what do we expect from you during the duration of this course? The first and foremost thing that we expect from you guys is to show up every Sunday on Zoom. Please show up. We have put in a lot of hard work for this, so we definitely want all of you to show up every Sunday. Without that, we can't help you. I know sometimes we have unavoidable situation. It's not possible. For those cases, we'll make sure that you get the recordings, which you can see later. But make sure you see those recordings either the same day or at least a day later, because it's going to make a difference if you see it the same day, or if you don't see it the same day and you see all of them combined at later. So I would just request you to first of all come to the class. If not possible, then at least try to see the recordings the same day or the day after that. The second thing is which we expect from you is to be interactive during these sessions. I expect this course to be an interactive session rather than a one-way lecture. We are all at a learning stage, and at this stage there should be no hesitation whatsoever to ask questions, no matter how silly they are. So just ask. If you do not understand a particular thing, you can just put it in the chat box and we'll try to repeat it so that you can understand it better. These classes will also have some polls and questions in between the lectures. So try to participate more and more in those questions and those polls. They will help you to assess your understanding on the go. And you can always unmute yourself to ask any doubts whatsoever you have at the same time, and we'll make sure that we'll try to address all of them. Your participation makes these classes more interesting, and it also makes us know how much you are understanding a particular topic, or whether we need to spend more time explaining the same thing again. The third thing I want you to do is apply whatever you learn from here every day. We're all working in hospitals, so whenever you come across an ECG in the hospital, make sure you actively see it and try to interpret it how much ever you can. No amount of teaching is going to leave an impression on your mind unless you actively apply it in your day-to-day practice. So if you practice this every day as the course goes along, you will yourself slowly start seeing how you keep getting better at it every day. The fourth thing I want you to do is to go home and do some reading on your own in addition to whatever you learn from the series. So for that, two books which I suggest, which are for basic ECG learning, which are really good, are The ECG Made Easy by John Hampton and Goldberger's Clinical Electrocardiography. So just get the physical books or get the PDF, download the PDF online, just read them whenever you get chance. So with this, I think we're all set to start this course next Sunday. I will set the ball rolling with the first class next Sunday, which is going to be about the basics of the anatomy and physiology of the heart required for ECG interpretation. Then we have a team of very eminent teachers like Dr. Mukund Prabhu, Dr. Manish Rai, Dr. Sudhakar Rao, who will take further classes. So I wish you all the best and hope that you guys will make full use of this opportunity. Thank you.
Thank you, Dr. Bhatia. Thank you very much. Yes, so it would be great if you are writing the names of the books in chat box, Dr. Bhatia. They're asking. Okay, and one more thing, as Dr. Bhatia has mentioned, the practice. So guys, the group is there. You have, you all are there in the group, around 800 people. So I would request all of you, like if you're going to the hospital, if you are seeing some ECGs, if you see something interesting, then post that ECG in the group and then discuss. That would be the open discussion with all of you, and I'll add Dr. Bhatia also to the group, and our other mentors also to the group. If you are not understanding, then definitely we will help you in understanding those ECGs with you, right? So I think that live discussion in the groups also will be one of the wonderful kind of assignments or kind of tasks for all of you and all of us as well to learn. So whenever you get some kind of ECG in the hospital and it's interesting, then definitely post that into the group, and we all are going to learn from them. We all are going to discuss. So everyone in the group who is, sometimes they feel like, they don't want to share because they don't want to ask the question. So they will also understand, one question can, enlighten the 800 people in the group, right? So always try to post those things and try to discuss those things. And now you all are allowed to open your mics as well. If you can't, if you're not typing, then you can speak. So now the session for question and answers, guys. Anyone who has any question or want to talk? Yes, everyone. No. Okay. Okay, I can understand today no questions, but from next time I'll not accept this attitude. We need a lot of questions. Yes, Miss Sahana, please.
Good evening, sir. I am a master student, sir, in pharmacology, and actually I have joined this first of all learn the basics of ECG in humans, but as I'm working on animal experimentation,
Okay, so one by one, please go ahead, Miss Sahana, please go ahead.
Yes. So as I said, I am working on an animal experimentation. So how much similar will these interpretation, what we learn, we can apply it to the animal ECG interpretation?
Good evening, Sana. So basically, this course is designed for people who really want to learn ECG about humans. We're not going to take care of ECG in animals in this particular course. However, the basic cardiac structure and the basic rhythm abnormalities and the ST changes, everything is similar both in humans as well as animals. However, so you will have to apply this knowledge and read about the modifications which you need for the veterinary population. But this particular course is not going to take care of that. I can totally tell you this right now. But you will get a basic knowledge of ECGs with which you will be better able to understand when it comes to interpreting the ECGs of the veterinary population. And so that's it.
Absolutely. Oh, and Miss Sahana, as I have worked with the animal studies also in the collaboration. So I have seen there are all heart chambers and all, because when we are working on the drug modules, when we are drug models, so we usually work on the rats or rabbits or which are having the similar kind of cardiac models with the human. So that ECG course is going to definitely help you, because you just have to correlate, you just have to establish the relevancy with those models. Otherwise the waveforms and all other things you are going to learn, the basics you are going to definitely you are going to learn in this course. But yes, you have to make your relevancy and you have to learn a little bit more from the books and from the literature to understand the animal part. Yeah.
Yes, definitely. Thank you, sir.
Thank you. Okay, so sir, how the exam will be conducted? Don't worry about the exam. It's Abhijit, it's almost 2.5 months, but yes, there will be multiple assignments as well, as I was discussing with Dr. Bhatia. So we'll be sharing some kind of ECGs as well from our side after whenever we are getting the chance. So you can analyze that thing and you can show up your skills to analyze that after the classes. So that would be there, and at the end definitely there will be one MCQ exam for all of you. MCQ exam that would be there after all the modules. If the pathophysiology of certain cardiac disease will added during the coursework, so that all can understand the root cause. No, definitely. See, it is it is not like that we are just if we are talking about the AV blocks, we will just start with the ECG of AV blocks. Definitely they will be correlating with the the physiology, they will be correlating with the disease symptoms, sign and symptoms, and the case. So you will not be it is not like that you will directly analyzing the ECGs. So definitely we are correlating with the basic disease models and all. So don't worry, basic cases we will be discussing.
One thing which we need to understand here is that no ECG interpretation is complete without the clinical context, right? So every ECG has to be read in the context of the clinical picture of the patient, including the pathophysiology as well as the management. So we will be discussing all of those things along with the ECGs, and we will be showing you case examples about not just an ECG, about a particular patient who's presented with a specific complaint, and then the ECG will be shown to you, and then we'll discuss how to go about it.
Yes.
So everything will be taken care of.
Yeah, don't worry about that. Don't worry about that. You will not be left, with anything. So if you have any questions, we will be there to discuss that things. Okay. So if we have to, frankly, guys, if we have to call our, mentors, like for one more extra class, then we'll not be hesitant. We'll call them, and they are always there, and we are always there for all the queries. Until unless you are not satisfied with the course queries and with the problems, we will not leave you. Okay, don't worry. What we are actually famous for. So our live classes means you will resolve your all the queries and you will get all the queries answered here. Don't worry about that. Okay, so sir, as there are some students who don't even know about ECG basics, so could you please start with the basics? If you have looked at the syllabus, if you have looked at the the schedule, definitely we are starting with the heart physiology, pathophysiology and anatomy, and then basics of ECG, then interpretation of ECG, and how to take the ECG. So we are starting with the very basics. Don't worry about that. Okay, it will be covered. Anything else, guys? Do you have any other questions? Okay, so I'm proudly, saying, guys, proudly declaring that, as Dr. Harnish Bhatia has told you, that we have around 800 admissions to this course and 2,500, another admissions who will be watching us directly in the YouTube. So we have around 3,300 participants in this course. So that is another, record-breaking kind of course for us and record-breaking thing, which is accepted, not only in India, but other 6 countries. I was seeing the registrations. So, we have the participants from 7 countries, including India. So thank you very much for participating in this course. And, I would love to see you every Sunday, and please come and join us for the live classes, guys. So if no more questions, we can take off for today. And yeah, thank you very much. Looking forward for the next class. Dr. Harnish Bhatia is going to start with the next class on next Sunday. So we'll see you guys. Thank you, Dr. Harnish, for joining.
Thank you so much.
Thank you, everyone, for joining, and we'll see you on Sunday, guys.
Thank you.
If anyone else wants to join, I invite all of you to circulate this to your friends who are, who might be interested now. After listening from you, then you can just, convey our brochure and the link with them, so they can also join right now. No problem at all. Okay, guys. Thank you very much. Take care, guys. Thank you.